Good morning, thank you for coming along. I've been joined by Deputy Secretary Naomi Bromley, who's going to give us an update on the vaccination program, and I've also been joined by Dr. Harsha Aluthki, a GP operating Melbourne's North and West, who's also going to talk to us about the importance of GPs and primary care in delivering support through this COVID spike at the moment, and particularly also focus on our vaccination program out in the wider community. So more than 15% of Victorians aged 18 above have now had their third dose, and that is a really important figure that shows how many Victorians are out there supporting themselves to stay ahead of this significant spike in coronavirus Omicron variant at the moment, but also supporting our frontline healthcare system and doing what we can to bring that growing spike of cases down as quickly as possible. That 15% is now more than 800,000 Victorians who have already had their third booster dose, and that is so important. More broadly, of the 12-year and above population, over 93% have now had their second dose. Yesterday, 20,776 people were vaccinated in our community, and we are seeing that momentum build day in, day out, and that is very important. More broadly, in terms of the growing number of COVID cases, the data report you would have seen today, we just need to go through that in some detail to explain and clarify a few of the significant figures that were in that report. But perhaps more importantly and more immediately, the figures as of 9:30 a.m. this morning, just to update the data report, there were 731 people in hospital as opposed from the 644 figure, which was from yesterday. And in ICU, the figure from yesterday was the 106 people. That figure is now 109 people as of 9:30. And fortunately, in regards to ventilation, the figure yesterday was 24 people on the ventilator. That figure is now down to 22 people on a ventilator. Very tragically, 9 further Victorians lost their life to COVID-19 yesterday, and we take this opportunity to issue our best wishes, our prayers and our thoughts for the family and the loved ones of those people dealing with that grief at this time. Yesterday, via the PCR method of testing, 24,928 people were diagnosed with COVID-19, and that was from 83,390 PCR tests. In regards to the now introduced rapid antigen test reporting online, as you know, we turned that system on yesterday, and we've had, as we expected, a very big response to the pent-up demand that we knew was out there in regards to unreported cases. And that figure has jumped significantly based on, it would appear, at least a week's worth of cases from the rapid antigen tests that were out there in the community. 26,428 Victorians self-reported their rapid antigen test positive result. There are probable cases as now defined under our public health rules. Whilst there were 24,928 diagnosed via the PCR test figure. So they are the so-called confirmed cases. Together, these cases of the probable cases and the confirmed cases totalled to 51,356 cases that are newly known to the Department of Health. That doesn't mean that the newly daily case figure has doubled in the course of 24 hours. What it means is it's now given us a realistic picture of transmission in the community. We knew there was undiagnosed cases out there. We're the first jurisdiction to put this system in place, arising from the National Cabinet decision earlier in the week. And what we now know is that the figure for cases in the wider community is more accurate than we had previous to just taking the PCR figure tests. Having this realistic figure allows us to put more people in contact with the support they need and get them through this challenging time of support as they deal with the isolation and the impact of their positive case. This is in many respects exactly what we wanted to happen, and we thank all of those people for reporting their COVID status to us. Nobody wants COVID, nobody wants Omicron variant, but it is so important for responding and keeping people in touch with services and support that we know who has turned positive in our community. It will necessarily take a few days to bed down this new system, and I suspect that we will continue to see higher case numbers than the actual number for the previous day for a couple of days yet, whilst those self-reporting processes work themselves out. And whilst PCR numbers will continue to be reported daily, as indeed will the rapid antigen test numbers, that system will smooth itself out, I'm sure, but in the context of continuing rising cases over the next few weeks. While the rapid antigen test results figures still reflect positive cases in the community, from yesterday's figures, only about 1 in 5 of those new figures from yesterday were from the 24-hour period of yesterday. The overwhelming majority tested positive earlier in the week, and they jumped online as soon as they could, and we thank them for that once the system was turned on yesterday. All these people will isolate from the day they first returned their positive test, and of the rapid results reported yesterday, 5,923 of those figures were from turning positive through the rapid antigen test yesterday. 6,700 plus were from Thursday the 6th of January. 5,000 approximately turned positive on Wednesday the 5th. About 3,800 turned positive on the 4th. About 2,500 on the 3rd. About 1,700 on the 2nd. And about 620 on the 1st of January. So we don't want Victorians to think that the daily transmission has doubled overnight. The reported figure has certainly significantly spiked based on that week's worth of unreported figures that we now have captured in the system. However, we should not rule out that there are still undiagnosed cases out there in the wider community, particularly as access to rapid antigen tests grows each day as more supply gradually comes online. Many of the rapid antigen tests that we've also had test positive are likely to also have gone and got PCR tests, so there's going to be a degree of doubling. Hopefully not too many, but the system will, as it cranks up, gradually identify those and work those double figures out. That's how we've built the system. It will take a day or two to polish up that data process, but we thank all of those Victorians who've registered their rapid antigen test as a positive. It gives us invaluable information to then make sure that the kind of work that we're going to hear that Harsha and his team in the suburbs and our other GP and COVID positive pathway partners keep people in contact with the support they need to get through their isolation period. So it's how we hook up people with that pathways the critical piece of information is to get you that support, to get you the link back to your mobile as to what your options are, to keep you contact with both your self-care and the support that both our primary care and our COVID Positive Pathways program support you at home to get through this important period as we come to terms with this significant spike in the Omicron variant. And without doubt, the increasing number of cases is providing significant challenges for our healthcare, be it primary care system or our hospital system. And these are very challenging times. But they are challenging times now 2 years into this global pandemic, and Victorians are resilient. Victorians know that as this variant cuts its way through our community, that the most important things we can do to support each other, to support our healthcare system, whether it be our GPs or our doctors, nurses and the healthcare and hospital system, is to firstly come forward and get that third booster dose, and secondly, to support each other through observing the public health and social measures that are in place. And Victorians are doing both of those things. The way in which we will get through this is through the support and the solidarity of communities, families and individuals all doing the right thing and taking their appropriate steps in a very challenging time, but a time that we will get through as we have got through previous challenges that the global pandemic has bowled up to us. And in that regard, the front line in many regards is our primary healthcare system, particularly our GPs and pharmacists. And whilst this is mostly an area of responsibility for the Commonwealth, all levels of government in the time of this crisis need to step up and help and do the support we need to keep our GPs and pharmacists, who are going through exactly the same kind of staffing and workforce pressures that everybody else is faced at the moment, to be that critical front line for vaccinations and for supports. That's why last year we ran a very successful program in the first and second dose times to get us to those globally high levels of vaccination in, frankly, record time once supply of the vaccine was available. We've reintroduced that, and we've brought that program back to both support the third dose program and the 5 to 11-year-old paediatric dose program, which commences Monday. Since the new year, we've been able to support over some 214 GPs and pharmacists through our grants program. And that program focuses on those parts of the state that are disproportionately underrepresented when it comes to primary care support in their communities, whether it be in the regions or the fast-growing suburbs of both the north, the west and the outer southeast. Those GPs and pharmacists, they know their communities. They understand the needs of their communities, the diverse communities, whether they be multicultural communities, particular groups that are vulnerable locally. GPs and pharmacists are really the people with their finger on the pulse as to where the needs in this really challenging time need the greatest support. And that's why this grants program of an immediate $10,000 to get out the door is so important to get them off and running. They can use it to hire more staff, whether it be immunisers, translators, or support staff to get people in and out of various facilities. They can use it to extend opening hours, visit other locations, work with high-profile, risky communities in their local areas to take that outreach support. Frankly, whatever good ideas GPs and pharmacists come up with to get the support to where it's needed the quickest, we're happy to play our part to support those frontline services. People like Dr. Aluthka, who will speak shortly, who plans to set up vaccinations in a local shopping centre in one of the areas that he operates in. Harsha has been a GP in the north and the west for almost 2 decades now, and is, amongst other communities, looking to how we can roll this program out, as I understand it, in Mickleham. He helped vaccinate so many people in the community through the first and second dose program that got us through a Delta wave, and he is now out there doing the same thing for the third dose program to get us through this Omicron wave. GPs and pharmacists know their community better than just about anyone. And whilst the Commonwealth, as I indicated, is the primary funder, or the funder for that primary care program, I think in times of crisis, communities would expect all levels of government to step up and be part of that response. I'll get Dr. Aluthka to say a few words. He'll then be followed by Naomi to talk more about the wider vaccination program, and then we're happy to take questions. Doctor.
Thank you, Minister.
Doctor, could you just spell your first name and surname, please?
My first name is Harsha, and surname is Aluthke. Aluthge. D for God, E for elephant. Harsha, Harsha.
Thank you.
Thank you. Thank you, Minister. Thank you for giving me an opportunity to express my views about the COVID vaccination program and the proposed vaccination enhancement grant by the Victorian government for GPs and community pharmacies. My practice is in Mickleham, Victoria. I work as a GP and I own the practice. That area has been always like a less vaccinated area, and also the infection rates were so high, and it's a very highly multicultural area. So as you all know, all of us are having a real difficult time since the start of this pandemic last year, and it's a worldwide agreed fact that the best way to combat this virus is getting vaccinated. Not only this virus, any other virus is the same principle. To combat a virus, either you should get natural immunity by contracting the disease, or otherwise immunity through vaccination. So we can't afford to wait until everybody gets the illness and achieve natural immunity. It has some devastating social and financial complications. The hospital and the healthcare system will be burdened by patients. So therefore it's very important to get the vaccination to boost up the immunity. I would like to thank the Victorian government, the Victorian Premier Daniel Andrews, Health Minister Martin Foley, Chief Health Officer Brett Sutton, and all the other senior officials. They have been doing a great job since the start of the pandemic to fight against this virus, and we are very fortunate that we are at this time we are like highest vaccine, one of the highest vaccination countries in the world, and the mortality rate, death rate was also very low. And it's especially important this recent step taken by the Victorian government to introduce a vaccination enhancement grant for GPs and pharmacies. I don't know, it's a really good step, but I don't know any other states has done something like that so far. So without such a grant, GP practices and other pharmacies and vaccination centers faces a lot of challenges in meeting up the expenses involved in this process. This is not an easy process. So we have to increase the hours of the practice. We have to increase the number of doctors, hours of the doctors, nurses and administrative staff, and we have to utilize a lot of resources. It involves a lot of time commitment. So without such a grant, it's really challenging to meet those expenses. So it's a really good steps, and on behalf of all the GPs and all the people in the community, I would like to thank the government again for this. This is not the first time we got a grant like this. We had a grant a few months ago, and then we really utilized that grant. Actually, we did all these measures what I mentioned, increasing hours and so forth. And also we did some mass vaccination programs in factories. And this time the grant is even higher. So we can utilize this grant this time to do more things, especially the children's vaccination, 5 to 11 years children's vaccination program starts on Monday, and also the booster dose started already. So we are planning to set up some pop-up clinics, set up some mass vaccine clinics in nearby schools, and also in factories, shopping centers, as the Minister mentioned. So it's a really good step, this grant actually. So my practice, as I mentioned, is in Mickleham. Is a multicultural area, a fast-growing population, and initially there was a lot of reluctancy to get the vaccine, and the infection rates were always high. So somehow we managed to convince these people. We promoted vaccination in our website, we promoted in our social media, we sent text messages to them, and also we made some influence through their community leaders, religious leaders, to some ethnic groups. So I'm happy to inform you that at the end of the day, so a lot of people actually got vaccinated, and I think as of now the vaccination rates and the infection numbers are more or less similar as other suburbs in our area. So initially it was not that like that. So with the commitment of the healthcare workers and with the enthusiasm of general people, I would like to thank the vast majority of Victorians who have been vaccinated. So by those process, actually we could achieve our target. And this time it is more important, the children's vaccination are coming up, 5 to 11 years. And by children vaccination, actually as the Omicron is spreading fast, it's really important for these children to get vaccinated because the schools are also starting. So they can start face-to-face learning, they can do their sports, extracurricular activities, they have the freedom, their own freedom. So parents will be very happy about that. So, and the other thing is, I'm very happy to announce that until mid-February, my clinics, 5 to 11-year-old children appointments are all fully booked out. So that shows how parents are keen on getting the vaccine. And getting the children vaccine has some added advantages. In Victoria, the adult vaccination rate is very high. So if children are also vaccinated, it gives us an additional protection as a family unit, because otherwise from parents, children can get, and children to parents, like inside the family, the virus can get transmitted. So finally, I would like to thank the Victorian government again, and also the vast majority of people for getting vaccinated. And also I'm really proud to be part of the vaccination team which has achieved one of the highest vaccination rates in the world. Thank you.
Thanks, Harsha.
Thank you so much, Dr. Aluthka. It's fantastic to have you here. A huge thank you to everyone who came forward for their third dose yesterday. We are starting to see an uptick in the number of people who are coming forward, both in the state system and also in the primary care system. Now, I am pleased to see that 30% of Victorians aged 70 and above have had their third dose, but I would really like to call out to that age group in particular. We'd like to see that number much higher. I also want to encourage families who do have children aged 5 to 11 years to make their plans for their first dose as quickly as possible. We are ready to go for Monday. The vaccines are in the fridge and the staff are all ready and trained up. Doctors like Dr. Aluthka will be vaccinating children in their own local communities, and we know that primary care providers are starting to increase the number of appointments that they have available as their supply has been arriving over the past few days. So the message is keep checking the clinic finder for GP and pharmacy availability, and also keep checking the state system, as we will continue to put more and more appointments in. In the state system, 3,500 children aged 5 to 11 will be getting their vaccine on Monday, which is really, really exciting for those kids. And in total, more than 21,000 children are now booked in to receive their vaccination in the state system over the course of next week, and 33,000 booked in altogether over the course of January. Now that's a really great result before the program even starts, but we do want to encourage families to make their plans and come forward as quickly as possible to get it done. So whether it's the third dose or vaccinations for kids, we want to make it as easy and accessible for all Victorians as possible. That's why we are continuing to boost capacity in the state system, with some additional sites continuing to come online. For example, the drill hall in the city will be opening up on Monday with 16 cubicles. That's for boosters, and also a couple of paediatric cubicles there as well. And that's also why we've extended the deadline for the grant to Monday afternoon. So there are still opportunities for GPs and pharmacies to get online and submit an application, and we'll try and get those grants approved as quickly as possible. We really want to make sure that GPs and pharmacists in Victoria have every opportunity to work with their local communities to provide access for all Victorians. Now, in the state system at the moment, this morning when I looked, there were 115,000 appointments available over the course of January for people who want to book in to get their third dose. So there is absolutely plenty of capacity, and again, more appointments opening up all the time, and lots of people still coming forward for walk-ups, which we do encourage. So, spots available. Anyone who had their second dose in September or earlier, now is the time. Come forward and get your third dose. Just speak briefly to testing. So yesterday we had close to 90,000 people who came forward to get tested. Huge thank you to all of those people, and as always to our wonderful staff in the testing system. Now that's a really high number, and that means there's continued high demand on our testing system throughout the course of yesterday, and I understand it is very busy again this morning. Now, we are distributing rapid antigen tests at over 40 of our sites now, and people will get 2 of those tests. So we are starting to see that create some relief across the PCR system, and those are for people who come forward and don't have symptoms, so that they'll be offered a rapid antigen test. Yesterday, 13,000 tests were handed out, so just over 6,500 people who were diverted away from the PCR system by getting access to those RAT tests. So as the supply continues to firm up, and as there are more and more tests available, we'll continue to roll this out and use both the testing system but also other mechanisms to make the RAT tests as accessible as possible for all Victorians. I'll hand back to the Minister for questions.
Thank you, Doctor. Thank you, Naomi. So happy to take questions, and just note the obvious that with so many people now isolating because of either infections or close contacts, we are seeing a big impact right across the community, in our healthcare system, in our distribution system, and indeed all the way through to, as I understand it, newsrooms. So every part of the community is facing significant challenges at this time, but we will get through it because Victorians are resilient people. And by supporting each other, by having the systems in place that both the doctor and Naomi spoke of, as challenges as it will be, the high rates of vaccinations, the high rates of support for the public health and social measures that are in place will get us through, particularly for the support for people like Dr. Aluthka and our hospital system. Happy to take questions.
Minister, obviously some people, when they saw, and I know you have explained it, but when they saw that 51,000 plus in isolation, they would have, for want of a better term, freaked out. In terms of that sort of sense of anxiety and panic, what's your message to the general community? Should we be freaking out, or is this or should we just chill for a few days and wait till the numbers settle down?
So my message to Victorians is, yes, that was a high number, but it reflects the pent-up demand of a full week of unreported rapid antigen test results. We would expect, as the system plays out over the next few days, in the context of increasing numbers in the wider community, that initial number will come back substantially. But I'd just say to Victorians, be concerned, of course, but be aware of the systems that are in place to support you, to support each other, and to support our healthcare system to get through a challenging time.
The modelling, this is beyond what the modelling was suggesting. So is our health system equipped, or are we in a new frightening phase in terms of dealing with what's ahead?
Well, we're certainly in a new phase. As we indicated a couple of days ago, Omicron has changed the outlook for the world and indeed for Australia. But in Australia, we do so from the basis of, as Dr. Alufgar pointed to, a very high second full vaccination program, and now a cracking pace in the third booster program. That gives us the ability to knock the top off that very fast-growing wave of Omicron variants. Not tomorrow, probably not even next week, but it will help bring it down, as will observing the public health and social measures, which so many people are now doing. Trying to restrict your movements, trying to make sure that you stay within your existing family and social circles, that when you are out, that you try to do whatever the event you are at, be it outside, that when you're visiting family, do it outside. When you are at a hospitality venue, following the new rules. If you can, do it outside, and just restrict your movements as much as you can. That's the thing that's going to help, particularly people like Dr. Alufgar and our frontline hospital workers who are doing it really hard at the moment.
Are you concerned that not everyone who's testing positive on a rapid is coming forward and reporting that?
Look, the numbers that came forward yesterday are really a vindication of moving to this system to give us better sight of people out there who previously we suspected were out there, we knew were out there, but we didn't have the formal link to them. Now we do. Are there more people out there who have yet to come forward? Probably. And we would encourage, particularly as rapid antigen tests increasingly become available and we distribute them freely and widely as we possibly can, that we will bring more people into the system, particularly as we see case numbers spike. So this is a good start. The numbers will wash out over the coming days, but there may well be more people out there who continue to be undiagnosed and therefore potentially unsupported in their COVID journey.
Do we have any updated modelling on how many cases we could get, what the peak would get to?
In this rapidly changing environment, we are working closely with the Burnett Institute about modelling. That is very dynamic at the moment, but it does seem to, we're working on the basis of the very close alignment that the Doherty modelling has, that was released through, well, was shared through National Cabinet, which was reported on 10 days or so ago. The Burnett, the Doherty modelling seems to align pretty closely, but we can expect, based on that, a few more weeks of significantly increased rates of infection before peaking, we understand from that modelling, in mid to late January and coming down into February. These will be challenging times, but challenging times that I'm sure we as a community, we as families, and we as workplaces, we as Victorians are up to.
What about hospitalisations? Do you have modelling on how many people might end up in hospital over the next month?
That's also been worked on. We are working on the basis that Fortunately, whilst Omicron appears to be a less virulent strain, certainly is a less virulent strain of COVID-19, its sheer infectivity advantage will drive, as we're seeing, the total number of cases up, and from that, the likely increase in hospitalisations. We're seeing today a substantial increase in people who have come forward to be hospitalised, but at the same time, a decrease in ventilating rates, only by 1, but it didn't go up. So it's how we pivot to now the hospital system having to cope in a hugely stressful time, but in a time with the support of Victorians, our frontline healthcare professionals, who have fronted up for 2 years in full PPE, in really difficult circumstances, in stressful work environments, now being furloughed with, through the same processes of either infection or close contacts or carers, in their thousands, thereby multiplying the pressures on the healthcare system. Our frontline healthcare professionals are doing an extraordinary job, and we will get through this with their leadership and the rest of the community supporting them.
There are other industries as well feeling the strain of this outbreak. The supermarket distribution chain as well. I think Coles and Woolworths estimated about 20% of their staff have been furloughed. Can the state government do anything? Can there be a similar situation where if you're a close contact in that particular sector but not symptomatic, you can go to work?
Yes, we're in close consultation with all the critical sectors. Indeed, those conversations are alive right at the moment. My understanding is that, again, to try to get some national and interstate consistency on these approaches, AHPPC, as they did for the healthcare sector, are considering those very issues over the course of the weekend. And what we have to do is to take appropriate but safe steps to keep those critical distribution and supply and services functions going over the next few weeks until we get through this significant wave.
On the tennis, what are your feelings on Tennis Australia giving that misleading information to the tennis players? And do you think Craig Tiley should be reprimanded for giving that information to them?
Well, the Australian Open is the world's best tennis tournament, and it's happening at the time of a global pandemic, and the entire Australian Open team deliver a fantastic event that makes Melbourne the sports capital of not just the nation but the world. This particular set of incidents, Victorian government's not briefed on the matter in terms of how people got into the country. That's a matter for the federal government. But Tennis Australia deliver an outstanding Australian Open, and in very difficult circumstances, I look forward to them delivering another great Australian Open.
Do these revelations vindicate the Victorian government that it had nothing to do with the train wreck of the past 72 hours?
Well, what we've said consistently is that matters of how people get into the country is a matter for the Commonwealth and their visa program. What we've seen over the last couple of days is lots of information come out, but that's all in regards to how the Commonwealth goes about its processes and how the tennis community goes about its processes, each of getting people into the country. These are matters for the Commonwealth and for the Australian Open.
Does the government regret partnering with Tennis Australia given that now 3 people have been stripped of their visas?
What we don't have any regrets about is partnering with the Australian Open to deliver a fantastic global Australian Open that is a significant event. And even though at the moment there are obviously some challenges, we look forward to the Australian Open being its continued success, not just this year, but as we get through this global pandemic for many years to come. Australian Open and Tennis Australia are really important partners with the Victorian government, drive so much investment, jobs and excitement, but clearly there's some issues at the moment between Tennis Australia and the Commonwealth.
Has the government spoken to Tennis Australia?
A big pardon?
Has the government spoken to Tennis Australia?
Well, I personally haven't, but I'm sure there's been conversations, as there is every year at this time of the year, about how we deliver a really important event.
Do you think the Fed's been playing politics with this at all? They grandstanding?
It's not for me to comment on the Commonwealth Government's approach to this matter. that's a matter for them to refer to. What I look forward to is making sure that we deliver a safe and exciting Australian Open.
Do you think anyone's going to turn up, given the caseload?
Well, we're talking with tennis about continually to look at their COVID safe plan. I think, as we demonstrated at the Ashes MCG Boxing Day test, that it is possible, particularly in outdoor venues, to deliver safe events. And we are continually looking at how we can update and review all of those COVID safe plans in the face of changing circumstances. We want to deliver that. The Australian Open want to deliver that. The tennis community wants to deliver that. And I'm sure Victorians want to deliver that outcome.
Are you going to go to the tennis minister?
I'm not planning to go to the tennis this year. I'm a bit busy.
Is the government still offering hotel quarantine to people who can't properly isolate at home, and is that still feasible with so many cases?
We're still running the hotel quarantine program, but clearly in a very different set of circumstances at the moment. We look forward to the Micklin facility being handed over fully to the state in coming weeks, and that will further add to our options. But clearly we're not in the position that we were in mid-2021. The vast bulk of our hospital quarantine, hotel quarantine program is at the moment for people who come into the country who are unvaccinated and don't have any supporting material, or they are local community members who are unable to quarantine safely. But given the sheer numbers of that latter group, it's simply not possible to accommodate everyone in that program.
And just quickly, could you please repeat, it sounded like there's been a big spike in hospitalisation since midnight.
Yes, so just to refresh those figures for you. So as of 9:30 this morning, as a result of data coming through that wasn't captured in time, there are now 731 Victorians in hospital. That's up yesterday from 644. There are 109 in intensive care. That's up 3 from the 106 figure. But the ventilation figures fell from 24 yesterday to 22 today.
I know we're splitting hairs here, but if we do the sort of vague numbers, are we still up? Do you know how much we are up daily, or is it too hard to extract that at the moment in terms of overnight?
Well, by courtesy of the figures that we spoke about earlier, so there's in total, both from the probable rapid antigen test figures and the PCR figures that all came in yesterday, that was 51,356. 24,928 of those were from the PCR tests yesterday. 26,428 were from an accumulated 6 previous days of rapid antigen tests, which had hitherto been unreported, were not capable of being captured, but as a result of Victoria being the first jurisdiction to turn on a system to capture that, came in from about 1 p.m. yesterday. So that's a big pent-up demand figure of 26,000 coming into the system. We need to know that information to give us the data and the planning tools to respond. It gives us age, it gives us postcodes, it gives people the opportunity to self-monitor and to report their conditions. It's really important data that will allow us to keep people safe through this significant COVID spike, and to keep really our healthcare system as adaptable and as attuned to get through a really rugged period that's going to face in coming weeks.
The active case figure is only for PCR test results. It doesn't include rapid test results. Why not, and when will it?
Well, I think I just indicated that it does include the total figure. So I think you've misunderstood the answer. So there were 51,356 probable and confirmed cases reported yesterday. Probable is the rapid antigen test category. Confirmed is the PCR category. Anything else?
Yeah, can you say what the current case fatality rate is, and should that give any reassurance to Victorians anxious about today's case numbers?
Well, any death is a tragedy, and any death from COVID is a death that we all regret. In terms of its actual relationship to the total number of cases, I'm sure we can get that specific data to you, perhaps through the Chief Health Officer's daily update. Anything else? Well, and best wishes to all the newsrooms out there. Thank you very much. Thanks, Doctor.